everyone, my name is Giovanna Farrow and I'm with Crossings Healthcare Solutions, and today we will be demoing the Hepburn Protocol Advisor. We sought out to develop the Hepburn Advisor due to the response from our facilities. Our facilities expressed the desire for a better solution to manage inpatient therapeutic anticoagulation. Heparin is a high-risk medication and was being managed manually using a power plan. Each time a lab was resulted, the nurse would access the sub-phase of the power plan to review the protocol instructions. This was a confusing workflow for our nurses that could result in patient safety risks and errors in dose management. This led us to develop the Hepburn Advisor. Our goal was to create an electronic tool embedded in Cerner that will be used to manage these patients in an effective, evidence-based manner. The Hepburn Advisor utilizes clinical decision support to present the nurse with the appropriate titration recommendation based on the patient's condition. The advisor analyzes the lab values and presents the nurse with the recommendation and appropriate next steps. This takes manual calculations off the nurse and reduces the risk of human error. In addition to an improved workflow for our clinical staff, the advisor promotes quality and variation reduction across our acute care facilities. Since implementing, we've seen improvements in the amount of time it takes for a patient to reach therapeutic range and the number of critical lab values. The Hepburn Advisor was designed to assist in managing continuous intravenous infusions for acute coronary syndrome, which is typically your low-dose version, venous thromboembolism or pulmonary embolism, which is your high-dose version, and neurological syndrome or stroke, which is a low-dose version without any initial bolus or subsequent boluses. In addition to accommodating multiple clinical conditions, the Hepburn Advisor can be used for both PTT and anti-10A monitoring. Prior to implementing the Hepburn Advisor, the workflow was using a power plan. The power plan workflow caused a lot of maintenance concerns for us as well as safety concerns. The workflow was the physician would order the power plan and the nurse would interact with the supplemental sub-phase of the power plan. Each 6 hours when a lab result would come back, the nurse would select the sub-phase, review the chart, and then adjust the titration as needed based upon the chart. Within the power plan, there were orders for boluses. If a bolus was required, the nurse was to place the bolus order through the power plan. Many nurses were having issues with this, so protocol management was taken over by the pharmacy. We saw this as our opportunity to create a better solution for Hepburn management, and that's when we implemented the Hepburn Protocol Advisor. The workflow for the Hepburn Protocol Advisor does remain the same for the physicians. They will still order a power plan, and we've created an advisor folder for them for easy access. So they select the power plan of the appropriate protocol they would like to follow, and you will see that it contains less information than our initial power plan. We really narrowed this down to only include the information that was necessary. So you'll see we have a link to the protocol document, which is right here. We have our bolus order if necessary. We have our drip order, and then we have our lab orders. We don't have our PTT order pre-selected in the power plan as that's typically already obtained, but it is available for easy ordering if needed. So the provider will come in, select the appropriate power plan, whether it be a high dose, low dose, or a neuro, and they simply have to initiate. Once they initiate and sign, the protocol order will be placed along with the drip and any necessary boluses. And once that power plan is ordered, you'll see an icon appears in the FYI section of the chart. If you click this icon, it will link out to the protocol documentation for the particular plan that the patient is on. This is an easy reference for anyone who's accessing the chart to see what the protocol entails, the ranges, and the associated adjustments needed. Once the provider places the power plan, the nurse will interact with the advisor. Once a lab monitoring result comes back, a notification will appear on the to-do section of the table of contents. The nurse will select the notification, and this will launch the advisor. Some things to point out when the advisor first launches is the patient data section. We have relevant labs pulling forward and some vital signs to give an overall impression of what's going on with your patient. In your top right, we have a reference document to the protocol, similar to what is accessed via the FYI icon. And there's also a refresh. So when the nurse first opens the protocol, they're going to see their recommendation section at the top. This information will display the current PTT result and what the current Hepburn rate is. The nurse is to click the confirm button to indicate that this information is correct. Once they click confirm, they'll receive the recommendation of next steps based upon that current PTT. Any orders that are required will be presented below and pre-selected. In this case, you'll see that there is a bolus and a PTT that's due. Once they review this information, they're ready to sign. Once the nurse signs the advisor, you will see the notification on the to-do section of the TOC is removed. Any orders that were necessary have been placed and are visible on the order profile. You'll notice there's a comment placed that indicates that it was placed by the Hepburn Advisor. In addition, if they forget the recommendation that was received, they're able to go to the results section to reference the pharmacy anti-coag flow sheet and review what that recommendation was. By simply navigating to the pharmacy lab flow sheet and selecting on the Hepburn text recommendation, the recommendation that was presented in the advisor is able to be reviewed and changed as necessary. Once the patient has reached their therapeutic range and the provider has determined the Hepburn drip is no longer necessary, the protocol will be discontinued. Once the protocol is discontinued, you will notice that the notification in the FYI section of the table contents also is removed. This will complete the protocol for the patient, but if you need to reference that the patient was on the protocol, you can simply review the results review or navigate to your notes section and review the physician order documentation that was created. This note type is created when the patient is started on the protocol and is part of the permanent medical record for any future auditing. That concludes the demo of our Hepburn Advisor.